we can look at the outcome or the behavior of the institutions. It certainly seems to have failed to meet our expectations of reasonable given the circumstances. Is that fair?
Yes, I think they failed us early on. I mean, like I said, that's why they got their degree, I would think, so you know how to do these things when the situation arises that the public needs answers. We need people who know how to do these things, do it rapidly.
Well, see, the points to this, it's like the policymakers. So that will be the authority figures who are in charge of the police powers of the state. They appear to be responsive to some political agenda. Does that make sense?
Yeah, the virus definitely got politicized. And, like I said at the beginning of the podcast, I was initially taking data on cases and putting them on these visualizations on these public dashboards for people to see. Well, I stopped doing that because I realized that the data was being gamed.
How so?
Well, when people start reporting on the number of cases, but they're not reporting on the total number of tests, then, that's a misleading result, right? If they're reporting on the number of cases, but they're not reporting on the number of hospitalizations, that's misleading. If they're not reporting on the number of people in the ICU, versus hospitalized, that's misleading. Because, a lot of what we did or what was done to mitigate the spread of the virus was allegedly done to prevent overflow of our ICUs, which would prevent, people from not being seen by the doctor because we just don't have the resources. So that was
the initially it was flatten the curve.
Yeah, exactly.
And it's interestingly, because it's the ICU admissions never really blew up. They didn't explode the ICUs, and the ICUs are largely, there's a lot of occupancy potential left at this point. And then there was this translation over the summer, and now it's cases, and it's like everybody's hyperbolically reporting cases, and it's like, yeah, now what are we talking about, right?